My name is Dr. Wendy Wilcox. I am an obstetrician gynecologist by training. My current title is Chief Women's Health Officer for New York City Health and Hospitals. New York City Health and Hospitals is the largest public hospital system in the United States. New York City Health and Hospitals has been for a long time at the forefront of patient safety and quality for maternity care. In 2018, we received a grant from our City Hall to create a specific program around maternal mortality reduction and severe maternal morbidity prevention. So simulation had to be a part of that. We have been involved seriously in simulation since about 2010. We have a simulation center for our health system. But what we learned from that is that it was really difficult to get all of the people who needed to take the simulation course from across our 11 maternity hospitals to this one simulation center. With this new initiative, specifically around maternal mortality reduction, we knew there were 3 courses that we wanted to train all of our staff in. Those courses addressed the top 3 causes of maternal mortality at that time in New York State. Those were cardiac disease, hemorrhage, and severe hypertension. We were approached by health scholars to think about and collaborate with them on creating a virtual reality platform for our simulation course. I had never really seen virtual reality before. Of course, I had heard about it in terms of like video games, but they had a couple of modules that were already done. And then when I put the goggles on and I tried the course that they then had, which was Fire in the OR, I was sold. I couldn't believe how realistic it was and just the experience. So our team at New York City Health and Hospitals was really eager and willing to collaborate with health scholars on a virtual obstetric hemorrhage simulation course, which is the first of its kind. We are really excited to bring this to the fore. This is really cutting edge. We definitely followed the evidence. So we took the guidelines from the American College of Obstetricians and Gynecologists, ACOG District 2, as well as the California Maternal Quality Collaborative, CMQCC, and really looked at the guidelines and created a evidence-based hemorrhage, a lot of logistics with in-person training. So really what we were looking for virtual reality to do was to increase access to our providers. So now they can access the course at any time. We have deployed goggles to all of our facilities. The software is in our computers, and we have simulation leads at each facility who will be able to help facilitate people taking the course on their own. We're looking at simulation to not only increase knowledge, but retain the knowledge that has been gained and allow people to continue to learn as other courses are being rolled out. They can always go back and retake the hemorrhage simulation. Another point I want to bring out is, with our in-person simulation courses, it involved people keeping track of response times, responses, a lot of clipboards, pen to paper, and then that data had to be uploaded into our computer systems. With the Health Scholars virtual simulation system, that data is kept within the system and can be used, tracked, put into various formats, and we can have ready-made reports from within the system. So it's a lot less labor intensive.